Hello guys, it's been a very long while and do accept my apologies. So I'm back and I'm hoping that I'll be back for a long time and more consistent. So I'm just not back empty-handed. I'm back with a topic, and today's topic is urinary tract infection, aka UTI. So let's talk about UTI. And if you work in a nursing home, you know very well that there is this, I think it's a culture whereby, oh, the resident is confused, or the resident is having dark colored urine, the resident's urine smells offensively, the next thing is a urine dipstick, and oh, this resident is positive to UTI, and the doctor is being informed for some antibiotics. So in today's video, I'll be talking about the reason why that shouldn't be done and the right way to look at UTI. So UTI is actually caused by bacteria entering the urethra and traveling to the bladder, and it irritates it and causes into signs and symptoms that are not very pleasant to the residents. And before I dive into this concept, I would like to explain the term asymptomatic bacteriuria. So this simply means the presence of bacteria in the urine, but it's not causing any harm to the resident. So as a result of this, there is no need to treat it because it's not causing any harm and the bacteria is not a bad bacteria. The cause of UTI, the most common one is the E. coli bacteria, which normally resides in the feces, entering the bladder through the urethra. So what are the signs and symptoms of UTI? We have some specific signs such as blood in the urine, pus in the urine, suprapubic pain, urinary frequency, urinary urgency, new onset of incontinence. That means they lose control of their bladder and they can urinate at any time, anywhere, without being aware of it or having control over it. And also new onset of confusion. So there are some signs and symptoms that are not specific, such as confusion. For instance, it could be as a result of other things such as pain. It could be as a result of dehydration or poor appetite or poor nutrition. It could be as a result of medication side effects. Could also lead to an onset of confusion in an elderly person. So that is not very specific. Sometimes you find care staff reporting to the nurse, this patient is there's a change in their mobility, or they've just fallen down, probably they have UTI, let's do urine dipstick. That is falling and not eating very well, a change in your mobility. It's not a specific sign of UTI. It could be as a result of so many other things. You could fall down because the blood pressure is low. There could be environmental stresses around them, and that is why they don't have appetite for food. So the specific symptoms are the blood in the urine, pus in the urine, discharge, suprapubic pain, fever. Those ones are more specific. So I did mention urine dipstick. So that is a way of checking if there's bacteria in the urine, but it is not very accurate because it's unable to differentiate between asymptomatic bacteria and actual bacteria that is causing harm to the person. So it's very important that before we do a urine dipstick, we actually have specific symptoms, and the urine dipsticking should be done not to diagnose a person of UTI, but to rule out UTI. So it means that there must be sign of fever, blood in urine, suprapubic pain before you go ahead and do a urine dipstick. Reason being that it cannot differentiate between bacteria causing an infection and bacteria not causing an infection. So what is the management for UTI. The management for UTI is encouraging fluids with the patient. That would help the bacteria to be flushed away. Doing proper continence care. So for women, it's important to wipe from the front to the back, not the other way around, because you don't want to introduce the bacteria from the feces to the urethra. So it's always from the front to the back. And doing timely continence care, changing their pad as often as possible. You can also administer paracetamol to residents, especially because UTI comes with pain during urination. So it also comes with fever, so that would help with the pain and the fever. And definitely they need to be referred to the GP for some antibiotics to be done. One thing about referring patients or residents that we suspect are suffering from UTI to the GP is they would often request for a midstream urine. It's important that you inform the GP that not every resident can have a midstream urine, because most residents do not have control over opening their bowel. Opening their bladder. So you need to let the GP know that this particular patient is incontinent of urine, so they don't have control over their bladder. Thank you for watching, and bye bye. Kindly like this video if it was useful to you, and kindly subscribe. Bye.